Oh, red light therapy! Is it hype or is it real? I don't know. Let's talk about it for a minute. Well, good news is about me is that I love to research stuff. We need to talk about red light therapy. Why would anybody ever want to get in this bed, and who is it for specifically? Number one, I think red light therapy is great. What I found is, clinically speaking, I've been a chiropractor since 2006, and for the first maybe 15 years of my career, man, people were getting well super fast. We're adjusting them. We're seeing tons of responses. We're adjusting their thyroid, getting better, sleeping instantly. Life is great. Then what happened is in 2020, COVID happened. And quite frankly, everybody started getting stressed out. And if you don't feel it, you must be living under a rock somewhere. We're like, not sure about the president of our country. We're not sure about where these viruses are coming from. Maybe you lost your job or got decimated because of COVID came in. Now you care whether somebody got a vaccine or not, or whether they wear a mask or not, or now we're just super polarized. And what that did is that all that stress affected our cells. So what I did is I said, okay, well listen, if our cells are being affected, and then what happened, fast forward to 2021, 2022, I'm adjusting people in our clinics, we're adjusting our people in our clinics, we're finding they're just not getting well as fast. So, I mean, it's the same great adjustment, but it's just a slower healing time. So what's going on? Well, here's what we found out. Stress is eating us alive. And this red light therapy is one of the most powerful things that you can do, easy. You just lay there to get the stress away. Dr. Ben, what in the world are you talking about? They have these things at my gym and that doesn't affect my stress. Well, it's not the same thing, okay? So there's a big difference. This is a low-level laser bed. What that is a different frequency of red light than what's called an infrared sauna. Now, infrared saunas are great for you, but really their benefit is just heating you up and making you sweat. So infrared saunas, they're good for your skin, but the red light of an infrared sauna doesn't penetrate more than maybe 1 millimeter inside of your skin. So is it good for your topical skin? Sure, but it's not gonna really do anything for your hormones. What we did is found some technology that there is some low-level laser that didn't used to exist. And now we have the technology with these powerful LEDs to create this. And what that is there's a few frequencies of red light. A couple of them that we use is 635 and 850. And those red light therapy frequencies stimulate your mitochondria to do 3 things. And if you remember from biology class, your mitochondria is the powerhouse of your cell. And what it produces is ATP, which is pure form energy, ROS, which is reactive oxygen species, a very powerful anti-inflammatory. And then number 3 is nitrous oxide, which is actually a vasodilator. It's like a natural blood pressure medication. So Dr. Ben, why would you need your body to produce more of that? Well, I'll tell you why, because that increases cellular metabolism and tissue regeneration. Those are big words. Let me tell you what. 2016, they did a study on red light therapy and braces. And they found that if you did 3.5 minutes, 1 time per day, of 850 nanometer red light, so the same that's in this low-level laser, if you do that 3.5 minutes, 1 time per day, the average time to move teeth with braces goes from 104 days to 48 days. It's crazy. Why is that? It's because it's stimulating the tissue around your teeth to produce cells faster, with faster cellular regeneration. Very cool. Now, we took that study and we said, well, I wonder what else can be effective. Well, there's a lot of studies that are coming out with red light therapy, low-level laser, how it affects your thyroid, how it affects your cells. So for me as a chiropractor, I said, dude, I want this for my offices. Why? Because if you walk into this office and you've had a whiplash in your neck, or you've got a disc that's being blown out in your low back, then I'm adjusting you. I want those cells to speed up healing. So as a chiropractor, we use this to help mold your spine. This is gonna literally take 9 months worth of care that we used to do, and now we can get it done in 3 months. It's that powerful. But what we found along the way is when you lay in this low-level laser bed, guess what also happens? It flips on your hormone cells. What? Yeah, it's crazy. Increases your cellular healing. Specifically for women, we found that they're having a hard time sleeping. Now they're sleeping great. We find that we've actually a few famous country music singers. They come and use our beds. They don't want to be adjusted on regular because they're always gone making excuses. But guess what they do? They love the bed. The second they come off from tour, they're laying on this bed and they're loving it. We've had several patients with blown out discs that literally they're just hobbling into the office and then they lay on the bed and they walk out of there. It's incredible because it's going to suck the inflammation out of your body. So I want to show you how this works. Now we're going to do this. I'm also also talk to some people that have issues with like your knees, your joints, your elbows, because you can use this bed to stimulate healing while you're using it to do all the other things like hormones, okay? And what you're gonna do there is you just wanna get it close to this light physically. So the closer to the light you can be, the better. Now, the way that these beds work, and we have a couple different types of beds in our offices. The bottom one, obviously you're real close to it because you're laying there and there's, those photocells only like this far away. The top one of this bed is only gonna go down between 12 to 18 inches away from your body. That's fine because these cells, these photocells, have a lens in there that's really a sharp lens, and it's going to be focusing those lasers into your body, that low-level laser, and it's going to be incredible. Now, I am not telling you to do this. In our offices, we wear eye protection. I'm not telling you to do this, but we have several patients in here that have vision issues, and they come in here and they don't wear their protective glasses, and they found that their vision has gotten better because it has stimulated your eye to produce your cells faster. Now, what we're looking for out of this bed is we want to get about 50 joules of energy. So light energy is measured in joules. What makes our beds very, very unique is it's the power, right? So you need to be very close to the light and you need the power. And our beds have both of those things. There's a lot of other beds, they don't have that much power, or the lights are really far away, like a tanning bed. They look like a tanning bed kind of. Some of them you stand in. Again, those are usually infrared saunas. And an infrared sauna just makes you sweat, does not do the same thing as this. So let's jump in this bed. Let me show you how it works. Now, we're gonna use our eye protection here just so you can see me use it. But when I'm in the bed, I do use the eye protection personally. But if you don't want to, just know that's on you. We are legally telling you to wear it. So we have, this particular bed has two remotes, one that makes the stand go up and down, and one of the remotes that turns the lights on. But let me show you what this looks like. So you come in here, you press the down button. This thing's gonna start automatically lowering down. Pretty cool. Get my eye protection in place. And then all I gotta do is hit on. It's preset for 10 minutes. I'm gonna hit on, and it'll be like this. Now, you're watching me right now in shorts. And you're gonna say, Dr. Ben, do you wear shorts? I wouldn't recommend it. Honestly, what I would recommend is stripping all the way down. And yes, I do mean all the way down. If you're comfortable with it, just come in here all the way down, and you're gonna lay just like this, easy peasy. Now, if you have any claustrophobia to this, just know that you can bring this up slowly and then you can stop it anywhere you want. Like if that's where you want to be, that's fine. You can bring it up a little higher if you want. That's fine. Or you can bring it all the way down. Now, if you have some issues with your knees, your elbows, maybe you've got arthritis in your fingers, put that right up against that light. If you're somebody, obviously with our chiropractic, we don't want to be sitting in here like this. We want to have a nice, good, easy, neutral posture. If you've got some knee issues, obviously it's getting from the bottom of your knees, which is fine. You can also bend your knees and put them right up against that light. That's perfectly fine. If you're somebody that's got hormone issues, you want to get as much skin exposed. Again, we talked about that. Strip all the way down. You want to get your skin exposed to this bed. And this is not going to tan you at all. This will not change you at all. Press the button here. By the way, you can turn it off at any time. But it's not going to tan you at all. As a matter of fact, it's not even going to barely make you sweat. What it's going to do is it's just going to help your body. You'll get a little bit warm. You might even get a glow, like a glisten, right? But it's going to feel good and it's going to be comfortable. When you get done, just let us know. Depending on how your office works, we have a very healthy cleaner. We just wipe the bed down. Easy peasy, ready for the next person. That's red light therapy. Make sure you check it out. It's for everybody. We recommend for everybody when you're doing corrective plans to definitely get your red light therapy. I like the membership model that we've set up, one adjustment a week, one red light therapy a week. It's incredible. In my opinion, it's gonna help you keep up with the cellular stress from your environment. Very, very powerful stuff. Listen, if you're sick, that's the best thing you do is come in here. Get in that red light therapy bed. Get an adjustment, nebulize the silver or gargle and swallow the silver and come in here and lay in this bed. That's gonna boost your immune system. It's gonna boost your cellular metabolism. This is how you're gonna stay away from drugs and surgery. This is the kind of thing that's gonna help you to be 85 years old where you're not on chronic medications with chronic pain. If you got fibromyalgia, by the way, one of the best things for you, tons of research. Cancer, one of the best things for you, tons of research. You want your body to increase your healing, and this is a healing accelerator. That's red light therapy, and I'm Dr. Ben.